Doctors say some patients are still delaying critical care because of the fear of COVID-19. Joining us now is Dr. Junaid Khan with Alta Bates Summit Medical Center in Oakland. And Dr. Khan, can you tell us what you're seeing there?
I think what we're seeing and what we're concerned about is patients are scared to come to the hospital. Now, honestly, some of that fear is really well founded, but what we're now starting to experience is people are delaying their care for heart attack or stroke or lung cancer. And I think what concerns us is that we want to make sure twofold. One, we want them to know that it's actually safe to come to the hospital. That is, if they're having chest pain, they have problems with their breathing, they should come to the hospital. Frankly, I feel safer at the hospital with respect to COVID than I do when I go to the grocery store. I think everyone in the hospital wears a mask. All patients are tested for COVID. In the hospital, the patients that have COVID are in a totally separate part of the hospital in a negative pressure room. So we don't want people delaying care coming to the hospital if they're afraid of COVID.
So what is your message to patients still concerned about coming to the hospital?
The first thing is I think patients should know that if I understand why they're scared, it makes sense. If they weren't scared, they'd be crazy. It's crazy times we're living in. But the hospital is probably one of the safest places you can be right now. We've done it, Sutter's Alta Bates Summit Medical Center has done extraordinary measures to protect not only the patients, but the staff. Also, if they delay care, it's not without consequence. Everything we do in medicine is risk versus benefit evaluation. Sometimes what we've noticed is that patients have come in, they've ignored symptoms, and they come in finally when they have a big heart attack. Well, if we have to do surgery at that point, the risk of the surgery goes up almost tenfold. Same thing, we've had patients who were very suspicious for having lung cancer, and they delayed getting their lung cancer treated. In those patients, boy, it dramatically changes their chances of being alive a year from now and 5 years from now. So we want patients to come in. We want them to know that we've done some extraordinary things at Alta Bates Summit Medical Center to protect them while they're in the hospital.
Talk about the other steps being taken to protect patients from the coronavirus.
I think it's important for patients to understand that though COVID is here and is going to be here for a while, we've done some extraordinary measures to protect everyone, the patients and the staff, when they come to Alta Bates Summit Medical Center. We've actually increased the amount of cleaning that's done in the hospital by environmental services. So all the surfaces are cleaned with bleach. All the staff actually wear a mask. All the staff are temperature screened. We've actually really essentially eliminated any outside visitors. And everyone in the hospital, all patients are tested for COVID right now. So, and the patients that are positive, we have very few numbers of those right now in the hospital. Those patients are isolated in a different part of the hospital in negative pressure rooms. So it's about as safe as it possibly can be. So we do not really want them to delay care based on that.
And you're not just talking about emergency care.
The other part is obviously we don't only want them to come in for an emergency, we want them to maintain their regular preventative care schedule. I can tell you that there's a large number of Sutter physicians that actually provide telehealth services. We were actually really first to get going with that, and we have lots of patients who choose telehealth. So if you don't want to come in, you can at least use one of the telehealth options to try to figure out whether you need to come in or not. We want to make sure that people maintain their regular preventative care options so they don't get sick.
And you say some parents could also be putting their children at risk?
One of the side things we've also heard recently is that parents have been holding back taking their kids in for immunization. That is very scary because the COVID itself is scary. The last thing we want is a measles outbreak. We want to make sure that the parents understand that all the pediatricians that work at Sutter have preventative measures in place. We absolutely want parents to maintain their vaccination schedule. COVID is one thing. The more common thing is the issues related to vaccination, measles, mumps, those kinds of things. We want parents to take their kids in. If they have concerns, they can again start with a telehealth visit or a phone call with their pediatrician, but we want them to maintain their vaccination schedule.
Dr. Junaid Khan with Alta Bates, thank you.